Hello, I'm Jim O'Brien, Vice President of Quality and Patient Safety at Riverside Methodist Hospital. Certainly, as you know, there's been an outbreak of the Ebola virus that has come out of Western Africa, and that's understandably raised concern amongst our community as well as our associates and our clinicians. We want to make sure that you are armed with the accurate facts about this disease so that you can have an appropriate, but again, accurate level of concern in caring for potential patients. One of the things to remember is that Ebola is a disease that is transmitted by bodily fluids. It is not transmitted through the air. And those bodily fluids are things that have to come in contact with our mucous membranes, our nose, our mouth, our eyes, for that infection to take hold in us. This is at greatest risk for patients who have the most severe form of infection and later in the course of their disease. Patients who are asymptomatic with Ebola cannot spread this infection to others. In order for us to appropriately protect our associates and allow them to provide safe and effective care to patients, we think it's very important that we go through the appropriate way of putting on, donning, and taking off, doffing, personal protective equipment. Now, knowing what you know about Ebola, as you see this, it may raise questions about why do I have to cover all of my body when I just told you that this is due to exposure with mucous membranes. The reason that OhioHealth has taken this approach is from learnings that we have obtained from other centers who have successfully taken care of patients with Ebola without causing harm to their healthcare workers. These centers are trained to take care of much more infectious agents, and they apply these strategies to other diseases like Ebola. However, out of an abundance of caution, we thought it most prudent to take this approach. You're about to see in the following video how to appropriately don and doff personal protective equipment in caring for patients who may have Ebola.
Room monitor or buddy trained in PPE donning and doffing will assist the care provider. The care provider will remove personal items and change into surgical scrubs and dedicated footwear, plastic or rubber washable shoes. Inspect PPE. Inspect for suitable and proper sizing. Review sequence of application prior to beginning. Perform hand hygiene with alcohol-based hand rub. Allow hands to dry thoroughly. Put on inner gloves. Put on shoe and leg covers. Put on gown. Ensure that the inner gloves cuffs are underneath the cuff of the gown. Put on N95 respirator and perform a seal check. Put on surgical hood. Ensure coverage of the neck, ears, and shoulders. Put on outer gloves. Ensure cuffs are pulled over the cuff of the gown or coveralls. Put on face shield. Verify equipment and freedom of movement. And disinfect outer gloves prior to patient contact. Prior to entering the removal area, care provider wipes off any visible contamination from the PPE with bleach wipes as the buddy observes from the outside through a window. Disinfect outer gloves. Disinfect door handle. Disinfect gloves. You are now ready to enter PPE removal area. The assembled doffing area will have a leak-proof infectious waste container, 2 chairs, bleach wipes, alcohol-based hand sanitizer, gloves, and a floor cover for clean shoes. Your room monitor or buddy will observe the removal of PPE. Once entering the anteroom, complete another visual inspection for contamination. Disinfect outer gloves. Sit and remove shoe and leg covers. Be sure to place foot on clean floor cover. Disinfect outer gloves with bleach wipe and remove. Inspect and disinfect inner gloves. If torn or damaged, remove, perform hand hygiene, and put on new gloves. Remove face shield. Disinfect inner gloves. Remove hood. Touch only the upper back part of the hood. Disinfect gloves. Remove gown. Avoid contact with scrubs. Roll the gown and cover off, touching only the inside of the garment. Disinfect and change inner gloves. Remove the N95 respirator. Remove the lower strap first from the back, lifting over the head. Disinfect inner gloves. Disinfect washable shoes. Sit on the chair and use bleach wipes to clean shoes. Disinfect and remove inner gloves. Perform hand hygiene. Perform a final inspection of scrubs for contamination. Wearing scrubs and disposable footwear, report to the shower. After assisting the care provider with doffing, the buddy will remove PPE. Disinfect outer gloves. Gloves should be disinfected prior to removal and anytime contact is made with the care provider. Remove the outer gloves. Remove shoe covers. Disinfect gloves. You may now remove your gown. Disinfect gloves, remove, and place new gloves on. Remove face shield. Disinfect gloves and remove. Perform hand hygiene. You may now leave the PPE removal area.